Welcome to the Krista Escamilla Show.
Hello, everyone. Welcome to this week's episode of the Krista Escamilla Show. We're glad you're here, spending some time with us, ready to do three of my favorite things: listen, learn, and grow. And I'm so excited because today is a first of this kind for one of our guests to be here. So we'll jump into that in a minute. But first, let me thank our sponsors. Without them, we have no show. So big shout out to Rig ID Workwear, also to Omni Midland Hotel, Kevin Foreman of Foreman Financial, the new Laughlin Hotel, Midland Cap Company, and joincapclub.com. Support those local businesses, or as I like to say, support every local business however you can, because local is where it's at. Mentioned it was a first of a kind. This is our first dentist to sit here in the chair today. We're so excited to have Dr. Helaman. Did I say it correctly?
You got it.
Helaman, yes, Erickson. I'm going to call you Dr. Erickson if that's okay from here
great.
on out, for being on the show today. Thank you.
Well, thanks for having me.
You are owner, one of four owners of the Permian Basin Oral Surgery and Dental Implant Center. And if you have four kids like me, many of your children have had their wisdom teeth pulled by what we like to call P-bombs, right?
That's right. That's correct.
A little easier.
Yeah.
But thanks for being with us today.
Well, thanks for having me, and thanks for the work you're doing here, shining a positive light on Midland. It's a great community, and as I was preparing to come meet with you, as we were talking before the show, it's just great to be able to have a positive light shine on Midland because it's such a wonderful community. And so
thank you.
Thank you for the work you're doing.
Well, thank you. We love it. It's easy because I get to shine on the people that are really doing the hard work. I just get to listen and share these stories, and I can't wait to hear yours. So let's talk about how you got to Midland, Texas.
Yeah, that's great. As you introduced, I'm a dentist, but more specifically an oral and maxillofacial surgeon. And I was in Dallas for my residency at Parkland Hospital. And I met Dr. Brown, David Brown. He started our practice probably, I think it's about 45 years ago. He's retired now, but he started the practice, and he went to the same residency I went to about 30 years before me. And at one of the meetings we met, and he said, "Come check out Midland and Odessa," and I said, "That's great. Where's that at?" And we
like a lot of people do say.
That's right. And so I came out and met the other partners. At that point, there was Dr. Porter, Kevin Porter, and Dr. Robert Fuentes, and I met those guys, great guys as well.
Yes.
And the practice just seemed to fit, and my wife liked the community, and so here we are 10 years later.
Good. And that's the most important part, that your wife likes the community.
Yeah, that's right.
Right? Because, and Midland is one of those places, once you're here, just give it, I'm just telling anyone that's moving here right now, give it 6 months to a year. You will love it and never want to leave.
That's right.
It truly is a great place. And I'm glad that y'all have made this your home.
That's right.
Yeah,
yes.
Welcome. Let's talk about, from there, you moved here, you're getting into the community. What do you love about what you do for West Texans?
Yeah, we have like you introduced me as a dentist, and that is correct.
It's more than that.
Oral and maxillofacial surgeons are different. They're a different kind of dentist. Many people don't know that there's specialties in dentistry. Okay. And so if you want to get your teeth straightened, you go to someone who has advanced training in straightening teeth, right? An orthodontist. Or if you need a root canal, you go to someone who does only root canals, because sometimes the difficulty level is beyond what you learn in just dental school. Mm-hmm. So an oral and maxillofacial surgeon goes to dental or medical school first, and then from there applies to a residency that is going to be 4 to 6 additional years to become an oral and maxillofacial surgeon. So you go to dental school for 4 years, and if you want to start a practice after that, you can, and you do get training in doing some of the things that we do as well. But if advanced training requires more time, and so there's residencies, and so as an oral and maxillofacial surgeon, we take care of not just the mouth, but the whole face, and we can get into more of that as we talk kind of about scope of practice and things like that.
Did you always know you wanted to do that, or was it one of those things that when you were in it, you went, "Oh, okay, this is the route I want to go down"?
Yeah. So when I was, I have an older brother. When I was 15, he had jaw surgery done, and jaw surgery, for those who aren't familiar with it, or orthognathic surgery, is where if someone has misalignment of their jaws, or like a big underbite or a big overbite, or their face is very asymmetric, that can be corrected, and it's corrected with a combination of orthodontics, where the teeth get put in the right position, and then surgery, where we take people to the hospital and make small bone cuts, and then are able to move the jaws into the right position. And so when I was 15, my older brother, he had to have this surgery. He had an underbite his whole growing up years. You really have to wait till someone's done growing to do this kind of surgery. Mm-hmm. And it really affected him. It's very traumatic to grow up with like a big underbite or overbite or an asymmetry. It's just it can be a challenge, and it was
something that doesn't make you feel comfortable, right?
Exactly.
With your smile or right.
Exactly. And so, but at age 19, he got orthodontic surgery, and I saw him after the surgery, and I looked at his face, and he had no cuts on his face.
Wow.
And I thought that was significant. I'm like, how did they fix the bones without making any cuts? Everything was done through the mouth, so all the scars, everything's hidden.
Yeah.
And I just thought it was amazing. And when I turned 16 or 17, I had the opportunity to work at a regular general dentist's office. I worked there, sterilizing instruments and cleaning trays and setting up rooms. But he's like, hey, you should go next door. And next door was an oral and maxillofacial surgeon. I'm like, yeah, I'm a little bit familiar with what they do. And I went over there, and from there, it took off. It was a fascination. I mean, he was doing wisdom teeth and things like that. Those are kind of the bread and butter things to do. But he had patients coming in for jaw surgery, and people he'd seen at the hospital and fixed, broken cheekbones and eye sockets. And I was like, wow, this is great. This is amazing.
Yeah, and I bet the satisfaction that you have when you've helped someone through something like that, because that kind of spurred you to do that. Now, when you see your patients and you can help them and change them, tell me what that's like, because I can imagine. And I've heard other dentists say this before. They have a lot of people that come into them, and they just want to talk like this. And sorry if I'm covering my mouth from the microphone, but they're trying to cover up what they don't like about their smile, right?
Yeah.
You get to help people really come out and be confident in their smile, but also in their health of their mouth too. Because
That's right.
taking those wisdom teeth out, I know, is essential. And I'm going to ask why in a minute, because my kids go, "Why are they taking my wisdom? Mm-hmm. I needed all that."
Yeah. Yeah.
So why do we have to take the wisdom teeth out?
So wisdom teeth can be asymptomatic or not be causing you any issues, but still be a problem, still cause pathologies. And so what I mean by that is you can have problems in the jaw, the gums in the area, or the wisdom teeth can affect the other teeth in the area. And so when someone comes in, they say, well, they're not hurting, why do I need them out?
Right.
And you look at their x-ray, and they don't have space in their mouth for them. And many times we see damage to the second molars. You can also develop cysts and things around wisdom teeth in your jaw. I've had people come in totally asymptomatic with 3-4 centimeter cysts in their jaw that are from having an impacted wisdom tooth. And so just because you don't have pain, just because you're asymptomatic, doesn't mean there's not a problem. And so when it's never a good thing. It's to put off pain in that area, certainly, but even asymptomatic people should be evaluated, and especially the teenagers.
Right.
Between the ages of 14 and 22 is the best time to remove your wisdom teeth.
And why is that?
So the roots aren't totally developed, and so the structures in the area, there's less risk to them. Okay. And so if you see your dentist and you're in that teenage group, and even if you're not having pain, certainly it's always good to be evaluated by an oral and maxillofacial surgeon to say if you should get your wisdom teeth out or not, because that's our specialty. We do it all the time. Like I said, that's the bread and butter, and we can guide you down that path. Some people don't need to have their wisdom teeth out, and we tell people many times, you don't need to have them out. You take care of them. You can keep these your whole life. But many people come in and they're sideways, backwards, upside down, all shapes and sizes of wisdom teeth. They come in all varieties.
I bet you've seen it all.
Yes, and it's better to remove those for the health of your mouth and for the longevity of your teeth and your bite.
Okay.
Yeah.
And I'm glad you mentioned that, because I don't want to age myself, which I mean y'all can guess with how old I am, but with much stuff as I say, I loved the 80s. But anyway, back in the 80s, this was not a thing. Like I went through my teenage years and nobody told us to take out our wisdom teeth. So I think I don't know, because you guys took them out. I must have been like 38, 39.
Yeah.
And I had a little bit of pain.
Yeah.
And went in and they're like, oh, you should take your wisdom teeth out. I'm like, why didn't anyone tell me before?
Yeah.
Is this a new thing that is now more suggested that we didn't do maybe in the 80s?
Yeah, that's a great question. It depends on the training of your general dentist and the dentist you're seeing for your cleanings and things, and what literature they've read.
Okay.
I wouldn't say it's a new thing. I would say maybe we're more aware of it, and so now it's
Good idea.
becoming more common. And so So like I said, it's always good to have someone who is doing this on a regular basis to evaluate your X-rays. And sometimes we see people say, hey, let's watch them for now. Let's see how your jaws grow and develop, and come back and take them another time if you need it. And sometimes people don't. When you look at skeletal growth of the face, in females it's completed about 15 or 16, and males about 17, 18. And so, sometimes we see people like, well, you might be able to accommodate these teeth, and there's other people you can measure, and there's no chance you're going to be able to accommodate these. Let's get these out where they don't have roots. You're young, you're healthy. It's going to minimize your downtime, and you'll be back at school and sports and everything in a few days, 3 days.
Yeah. And so let's talk about the process, because once, like I said, I've been through it with the kids. There is a fear. I don't know if you know about this, Dr. Erickson. There's a fear about going to the dentist for a lot of people.
I hear it every day. I hear it every day.
So let's ease the fears today. Let's talk
that.
about some of the ways to ease the fears. You have gas. There's a little pill, I believe, that you take before. But I'm not the doctor he is, so I'll let you tell the process.
Yeah, for sure. So with Oral and Maxillofacial Surgeons, we do a 6-year residency. And as part of that residency, we're an anesthesia resident. So we go into rooms, we intubate people, we run the whole thing, we learn how to do general anesthesia. When you come to see us, we have nitrous, we have pills we can give you, but we're going to give you general anesthesia with IV sedation. And so what that means, I'm going to start an IV in your arm, I'm going to numb up your arm, and you're going to go to sleep after I put that IV in. You're not going to remember it, you're not going to feel it. All 4 of us in the office are trained. Our office is certified to do anesthesia. It's been checked by the medical board, the dental board, and the American Association of Oral and Maxillofacial Surgeons. So we're going to put you to sleep, and you're not going to remember or feel anything. Once you're asleep, we still numb up those areas so that when you wake up, you won't have any pain, but you're not going to be awake for any of the procedure. And so, and we're specifically trained as this branch of dentistry to have that kind of training and skill. And we're under close scrutiny for anesthesia, because that is something that the medical board watches, the dental board watches,
right?
And
it should, right?
As it should, because there is risk with that. But when you have a group that we do, we're each doing 5 or 6 IV anesthetics every single day. We're very good at it, and we have regular drills and practice emergency things, and we're all trained to rescue if there's issues during the anesthesia.
Right. And that's important, to know that, they are trained to do this. You're going to be safe. It's not going to hurt. You're not going to feel a thing.
That's
because of the procedure that is in place. You won't feel a thing. I think it's more the fear and the anticipation that gets people a little, nervous, right? So what would you say is the number one thing that people can do before they come in to go, hey, it's going to be okay. Don't be scared.
Yeah. So occasionally we have people who I say, well, if you can get to the chair, we can start the IV. Well, I'll give you IV, Xanax, and you'll be asleep, right? Or you'll be without. They'll take that away. But some people are like, I'm not even going to be able to make it over here. So in that case, I do prescribe, or we do prescribe people some Xanax or some Valium, something to help them the night before and the morning of to kind of get them over, get them over that fear, and then we take care of them, and our patients are always very excited afterwards, because they wake. Is it over yet?
You're right.
It's already done.
They think nothing happened. That's what my kids are like. They're like, nothing happened. I don't. And they all act differently afterwards.
That's right.
That car ride home is fun.
It can be very fun. It can be very entertaining. Many times we hear some very funny things come out of the children's mouths, and so
I bet
it's very entertaining.
It's a truth serum.
Yes,
we're going to call it the truth serum.
It is definitely that.
What is the number one myth or thing that you want to debunk about dentistry in general? Like, I don't know. You always hear brush your teeth, floss, all the things, right, that we hear. What, as a professional, what do you want to debunk today?
I mean, one of the biggest things I hear from people when they come into the office is they say, I didn't know there were different kinds of dentists. They thought a dentist is a dentist, that we're all the same.
Yes.
We come out of school and some of us just happen to do certain things. It's not the case. There's residencies for specific problems. Just like you go to your general doctor, and your general doctor maybe hears your EKG's off. They're going to send you to a cardiologist, which is a specialist,
right, who's
going to take a look at things. It's the same thing when you go to your general dentist. They may see things that, okay, I need to have a specialist look at that. And so not all dentists are the same. And there's dentists who do get training after dental school and things, and do some of the same things. And if you have the right training to do the certain types of procedures you want to do, that's great. But that's one of the big things is many times I have people come in and
think they all do the same. It's a
they
blanket,
think it's all the same.
dentistry.
Exactly. They think it's all the same, and the reality is, if you need surgery, you want to go to a surgeon. Where
Right.
Or if you need, like I said, your teeth straightened, you go to someone who straightens teeth.
Right. It's the difference of a pediatrician and a brain surgeon,
That's right. That's
Completely
right.
different training, different. I'll never forget. We had a friend that was an internist and then decided to go back to school and be a cardiologist. It's not like he could just go, "Oh, I'm going to be a cardiologist now." You got to go
Exactly.
back and train for that
Exactly.
because everything is different. So that's a good way of looking at it. So
Yeah.
not all dentists are the same.
That's correct. There's different
Find
training.
the one that is meeting your needs. But that's a good question to ask
Yeah.
because I think a lot of people think, "Oh, well, they can just pull my teeth and then they can put my braces on." No, it's
Well,
a different.
so
place.
they can, and if you have the right training, you just want to make sure whoever you're going to
Is trained.
has the training to do it, because there are ways to go to courses and things where I mean, do you want someone who's been trained on taking out wisdom teeth for 6 years, or you want someone who has occasionally does it and took a weekend course? That's the question.
I'll take 6 years, please.
Yeah.
Yeah.
So
Yeah, good point. Good
Yeah.
point. Awesome. We do something called Quote of the Day.
Yeah.
And today we're sitting here in Midland, Texas
Okay.
with Dr. Erickson, and he is with the Permian Basin Oral Surgery and Dental Implant Center, but as we like to call in our family, P-bombs, because it's a little bit easier to remember. And we're learning about dentistry. This is fun, and he's going to pick out his card. Let's see what
Okay.
you get. All right. Which one did you get? You got the caring card, because a doctor needs to be caring. I love
exactly.
that.
That's why I picked it.
What'd you get?
You want me to read it then?
Yes, read it, please.
All right. Too many of us are not living our dreams because we're living our fears. Les Brown.
Good quote. What does that quote mean to you?
I mean, sometimes it seems that we give up what we really want to do when we get comfortable in what we're currently doing, and you have a certain job and you're doing well, and maybe you're giving up something you want to do more to be able to kind of the golden handcuffs type of thing.
Right. Yeah. Do you have a favorite quote you live by?
You know what? I was a Boy Scout growing up, and one of the big, one of the mottos is "Do a good turn daily." It's always stuck with me.
I like it. I like it. If everybody did that, imagine how the world would be a better place, right?
Yes, that's right.
And there's a lot of you doing that, so don't get me wrong. Yeah, a lot of people, but I love that. That is fantastic. Let's talk a little bit about aftercare, what people can expect afterwards, and then how do they know if they need to come see you? So first of all, aftercare. Let's start with that. So they've gotten the wisdom teeth out. I think this is a big, and I don't know, tell me if I'm just making this up, but you're is it a myth you're not supposed to drink through a straw, or you really are not supposed to drink through a straw?
It just disrupts healing. So for 7 days, we tell people don't drink through a straw. You don't really want to actively spit anything. It's just like if, let's say you had a wound on your arm, and it had stitches in it. You don't want to be messing with it all the time. It's the same thing, except this wound happens to be in your mouth, and you have to still eat, and you have to still drink fluids.
That's the tricky part.
Yeah, that's the tricky part. So we have people, don't eat don't suck through a straw. Don't actively spit for about a week. We're going to give you extra gauze. You're going to bite on the gauze afterwards. If it's not bleeding, you take the gauze out. Really, when young, healthy people, even people in their middle-aged people who are taking wisdom teeth out on you, we're going to be biting on the gauze for a few hours, then the bleeding is going to stop. Although some people will ooze for maybe up to 24 hours potentially. Other than that, you're going to stick with a soft diet, not spicy, no carbonation for about 3 days. After about 3 or 4 days, you can go back to whatever you normally like, and then.
So you're really down for maybe a day.
Well, you're going to be sore for 3 or 4 days. You'll probably be taking some of the prescribed pain medicine for 3 days. And then even up to a week, you may be taking Tylenol or Motrin. But it's something that would be manageable. You could go to work and school and things like that after about 2 or 3 days.
Yeah, do it on a Thursday or Friday, and then you got the weekend to heal, and you're back at it
You're back
Monday.
That's right. Yeah,
I love that. So let's talk about it. If what would be a sign they need to go besides age? So we now have said between 14.
14. If you can get in before the roots, so the roots are completely formed at about 22 for most people. And so if you can get in and at least have them evaluated before that age, you're really doing a big service. Because I will say, teenagers, and you've probably experienced this, they bounce back pretty quick from the wisdom teeth.
They do.
Adults who we take wisdom teeth out on, they don't bounce back as quick. It's a little bit takes a little more time to recover. And so if you can have them evaluated, because if you need them out while you're young, this is a better time to do it.
Yeah. If you're older like me and you didn't get them out when you were young, what are the signs? Like, how do you know when it should be looked at?
Yeah, really, when you go see your dentist for your cleaning, you should have a panoramic x-ray or like an x-ray of your whole mouth and jaws. I believe they do that every 2 years. And at that point, they should, if there's wisdom teeth, especially if you're having pain, you should take one of those x-rays and see what's going on. And then, if they need to come out, we still, obviously we still see plenty of people who didn't have their wisdom teeth out and who are older than 22, and we take them out, and there's things we do to help people through the process. We give them, medicines that help to decrease inflammation. We give you an ice pack at the end of it to help keep that inflammation down as well. But any kind of drainage from around the teeth or swelling in your face in that area. Decay really is an indication to remove wisdom teeth, because if you can't take care of it and it has a cavity, a lot of dentists don't fill those teeth. You just have them out, especially they're in the back of the mouth, and they cause more problems than help you chew. So
gotcha. What advice would you give to someone that has not been to the dentist in over 20 years?
You just got to go. Just go.
Just go.
Just go. You got to
hear that, Al?
You got to be evaluated. There's more and more literature and research now saying that there's a lot of disease processes are linked to the mouth. For whatever reason, however long ago, whenever they made dentistry a separate, separated out from medicine, people think that somehow the mouth is separate from the rest of the body. Obviously, it's not.
It's not.
And so
either the eyes, right? Like ophthalmologists probably got separated too.
Yeah. All this, everything's kind of divided up, but especially dentistry, for whatever reason, it's just this. They have, has its own school and all this stuff.
Right.
It's kind of like go to heart school right away. You go to medical school, then you go do it. But
right. Just go.
Just
is
go.
Is the answer.
I would say
go to school.
Go visit your dentist, and worst case scenario. Let me tell you the worst case scenario.
Okay.
Yeah, let's say your teeth are there's no way to save them. There's no way to fix them. We have options for you at our office, and what I mean by that is we can do a full mouth replacement. We have you come in the morning. We call it teeth in a day or smile in a day.
Really?
And you can go to sleep. You won't be awake for any of it. And this is if your teeth are not salvageable or fixable.
So far gone, you have to get implants? Is that
exactly
okay.
right? So you're going to go to sleep. We're going to take out your teeth, and we're going to place 4 to 6 implants in each jaw. And on those 4 to 6 implants, we're going to place teeth that will that day be screwed into the implants. So you're going to leave with a brand new smile. And beforehand we design how your smile is going to look. And then even after we're done with that, 3 months later, we make you a final set of teeth that are going to show that you can change or alter, because some people don't want the bright white. They want maybe a little variation so that it looks more natural.
Right.
But yeah, you can design your smile however you want it to look.
Yeah.
And so that's the worst case scenario. If you go to the dentist, it's not over just because you have to have your teeth out. And there's other options too if you can't do things like that, where you have dentures that snap onto implants.
Right.
But dental implants have really changed the way we can restore the form and function of people if they have to have teeth out.
Right. That's fantastic. And I understand that because I've got a family member going through that. So it really can. And it makes a difference. You don't realize how important your teeth are until they're not there.
That's right.
And so with everything, everyday function, with eating, and so they're so important. That's why you should go to the dentist. So
it's a quality of life
It
issue.
is.
And I see people all the time, in their 60s and 70s saying, why do I want to get an implant? I'm like, you want to have a good quality of life. If you plan on living to 80 or 90, the average lifespan is high.
Yeah.
The way you eat and function with your mouth is going to make a big difference in how good of a life you have.
Right. That's true. All right, time for something we call favorite things.
Okay.
We're going to ask you your favorite things.
Man.
But before that, really quick question of the day.
Okay.
All right, so grab the magic card. Let's see
Okay.
what you get. What card did you get on the outside? Let's see. What's the other side say real quick?
Oh, unique.
Unique. Okay, very cool. What is your
Okay,
what
so
is your
it says,
question?
how do you set goals, the process?
Good question.
So I try to divide my goals into four different goals. I set them every year. So there's a spiritual goal I set. There's an intellectual goal I set. There's a physical goal. And then there's a social goal. So I set. I use those categories to set goals for what's going to go on for me that year.
Perfect. I
Yeah.
love that. I like that. Al agrees. He likes that. Yeah, good. That is a good process. We're going to take some of those and implement it. I like that. Those are 4 good places, because then you can really kind of see the outcome of it, right? When you put it and when you separate it, instead of just going, I'm going to I don't know, climb a mountain.
Yeah,
You can actually be more specific within your your 4 different areas.
Yeah, well, it gives
love that.
it gives you an opportunity to try to grow as a whole person, not just in one area.
Yes, I love that. Well, thank you for sharing that.
Yeah,
Okay,
you're
favorite things. Let's start with favorite coffee shop in Midland.
Favorite coffee. So I don't drink coffee, but I drink hot chocolate and herbal tea. Let me think. What's it up at the Summit Center? We just had that the other
Oh,
day.
12 Gate?
That's it.
Yes.
Yeah.
So good.
Yeah.
Yes,
it was
12
great.
Gate. If you haven't
Yeah.
been yet, go see
the
it.
office loves it. We just went up there the other day, and
It's not too far from y'all's office.
It's not.
That's
It's not far from our
perfect-
Midland office. Yeah, it's
from
close.
the
It's like
Midland
5
one.
minutes or so. Yeah,
That's a perfect
Yeah.
place. What a great place. We one of these days we're gonna have Christina Lee on to talk about how she created it.
Yeah.
She's a pretty busy girl, but she made an amazing center there. I mean, it truly is just unbelievable. And 12 Gate, gem in our community. I love that. Favorite restaurant.
Probably Cork and Pig.
Yes, isn't it
probably
good?
Cork and, it's
Do you
great.
love the pizza too?
Oh yeah.
That's our
for
favorite.
Sure, for sure.
That's our favorite. The salad's good too.
Yeah.
And there's a lot more other good things, but pizza.
Yeah, Cowboy Prime's gonna be mad at me now. I like Cowboy Prime too.
So you go back and forth.
back and forth.
Back and
Whichever
forth.
can get me in sooner.
There you go.
That's
That,
right.
yeah, I get that.
Yeah.
Who can get us in? Two great restaurants, both two great restaurants. Okay, favorite podcast.
Favorite podcast. That's tough. I listen to a podcast called Data Over Dogma. It's kind of a Bible study podcast.
Awesome.
I really enjoy, and it goes into a lot of kind of biblical scholarship and things. I just find it very interesting.
I know. I was going to say,
check it out. It's
we're going to
very,
write
very,
down
very
Data
interesting.
Over Dogma.
Data Over Dogma.
I love it. Data Over Dogma. Favorite book.
Favorite book. Wow. Wow, I should have been prepared with these.
No, that's the beauty
questions.
of these. These are supposed to be off the cusp.
Just off the
yes.
Okay, all right.
First thing that comes into your mind.
No, I mean just along the same lines as the Data or Dog. I really enjoy. I do read the Bible. We read it with our family, and
the best book out there.
I like to read different translations of it and things like that, which gives you different perspectives on things. Yeah.
Great, fantastic. Okay, this is gonna be a tough question. Favorite toothbrush and toothpaste? He's a dentist. I have to ask, right? Because should you use the soft one? I mean, like,
always.
What are the questions?
I don't know why hard toothbrushes are even produced. There's no point. I guess if you want to scrub like your grill at home. But no, the soft. Always use soft or very soft. There's no point in anything. But you're gonna damage your gums and the enamel on your teeth. But I think the best toothbrush is a used toothbrush. Because,
really?
Meaning, if you've used it,
Not
that's
by
good.
others.
Not by others. If you've used it, like that's a good toothbrush because you've taken care of yourself.
Okay.
And so I don't get it too much into the brands, and none of them are giving me any kickbacks. So
but they're not paying us to sponsor today.
Use your toothbrush. Use
Okay,
it, yeah.
a used toothbrush. That's right. And
Yeah.
how about toothpaste? Is there one better than the other? You stand there in the grocery store and you're like, which one should I get?
Yeah, I mean, it's kind of a loaded question. I mean, I would say. Again, if you're brushing your teeth at least twice a day, you're doing well.
That's the goal.
I mean, it's
twice a day.
Some people just use water and baking soda, and other people use Crest or Colgate or whatever you want. I think as long as you're doing the work, you're gonna do well.
Perfect. Favorite fun fact about you we would not know by reading your bio.
Favorite fun? Wow. Okay. I went up Kilimanjaro last year.
Really?
Yeah.
See, when I said
when you said climb a mountain,
goal of climbing a mountain,
right.
what I should have known that you climbed a mountain. That's great.
It was a blast. It was fun. Great.
That's awesome.
Tanzania is a great country. So
very cool. Awesome. And what advice would you give to someone that's their goal since you've done it?
I mean, it's just make sure you got the lungs for it. That's it.
Yeah, I guess
it's tall. It's about
19,000
feet, over 19,000 feet.
How did you train for that in West Texas?
Just get on a bike or a rower and just go.
Okay.
Yeah.
Yeah. Go find some hills somewhere.
No, I'm saying like a stationary one.
Oh, stationary bike.
Yeah,
Okay.
If you can get to some hills, that's great.
Okay.
There's nothing
the
really
bike,
close.
the
bike or rower, just spend
Okay.
some time on there.
Yeah. That's so cool. Fantastic. Congratulations.
Thanks.
Favorite life hack, something that makes your life a little easier. You want to share it today and hope it helps someone's day.
Okay. I mean, I guess just I always like to have what I'm going to wear the next day, like picked out, so I don't have to. It's one less thing to think about in the morning.
Preset your clothing.
But I will
a good
say,
life
it's
hack.
pretty easy. I usually wear scrubs every day, so it's just.
It's a good point. That is a good point.
Yeah.
But preset,
Yeah.
we are big proponents of it. I used to get up for the morning show at 3 a.m.
Okay, yeah,
and
that's
so we
early.
would lay out the kids' clothes
Yeah.
the night before because it's one less thing you've got to think about in the morning. So I love that. Preset the clothing. Okay. Favorite memory in West Texas?
I mean, there's been a lot. Just one that comes to my mind right away is my oldest daughter is finishing. She's graduating from Midland High.
Oh, congratulations.
Bulldogs, right?
Go Bulldogs.
Yeah.
Big shout out.
And she's a swimmer at COM and also on the high school team. I was able to go and on her being recognized as a senior and be there with her and just
Aw.
see all the support of the high school and the COM people. I thought it was really great.
That's awesome.
Yeah.
And speaking of gems in our community, COM is one
That's
of them.
amazing.
I mean,
She's been swimming there for over 10 years, and there's just been so many great coaches who've influenced her and helped her, be her best.
absolutely. Well, thank you for playing favorite things.
Yeah.
I appreciate it. We're going to close out by asking you, is there anything today that you wanted to talk about that we haven't, maybe that your staff prepped you for and said, hey, you should talk about this, or or your wife prepped you for and said, hey, talk about this? Anything
Yeah.
in general?
No, I would just say, there's so many great dentists in this community. We have a study club. We meet up every month.
Oh, I didn't know that. That's great.
Yeah, we meet up and we go over kind of complex cases, and we like to have every specialist in the room so we can go over how we can help people with serious problems. And it's been very rewarding. There's so many great dentists out there that we work with who refer people to us. You don't
Love
have to be
that.
referred to us. If you think you need your wisdom tooth out, come just give us a call. We can take an X-ray and evaluate things. But we just all four of us, Dr. Porter, Dr. Fuentes, Dr. Jones, and myself, we just really love being part of the community. We love taking care of this community. We live here in this community. It's one of the things you'll find around here is there's many people who travel in and out of the community. They won't commit to the community, but we're here. We live here. Our kids go to the schools here, and we're committed to Midland and Odessa, and we want to help the people here.
I think
And
that's
so
fantastic.
I know on your show you always say choose local. We are local. And we want to be your oral surgeon if you need wisdom teeth out, if you need a dental implant, if you have a broken jaw, call us, we'll fix it. If you need a jaw surgery, if you have TMJ problems, we have a large scope of services we offer. We want to be there for this community. You don't have to go to Dallas to have an all-on-4. We do those right here all the time, every day. You don't have to go to Dallas if you need jaw surgery. You don't have to go to Dallas if you have a broken jaw. I know a lot of people will trek to Dallas or Lubbock because they think services aren't offered, but we're here.
Right.
And we're in this community. We take care of the people in our community.
I'm glad you said that because that is so true. I mean, we really do. We have great care here and that people that love and choose to live here. And so thank you for doing that. We appreciate that. We do have to have a special shout out to Mim, who I've known
Of
for
course,
years.
yes.
Hi, Mim. Thanks for
Yeah.
getting Dr. Erickson on the show today. I think it's been great to learn more and to have the first dentist on our show. Not just dentist, let me say, oral surgeon.
Yeah.
That's right, oral surgeon on the show. And share this information because I think there's so much about, your industry that us common folk, we don't know about it, right? I mean, because it's not our space. And so thank you for, letting us go into your world and for you to share it. Any final words of advice for a fellow, student out there that wants to follow in your footsteps?
Yeah, you know what? I had so many mentors growing up. I talked about working at a dentist's office and meeting with my brother's oral surgeon when he did his jaw surgery. But if you have an interest in dentistry or in oral and maxillofacial surgery, call us up. We have people shadow us all the time, and I know there's been a number of assistants of ours who've gone on to become hygienists and have applied to dental school and other things, and so. But we love having people because we're passionate about what we do.
You can tell and that's great.
And we'd love to have you come by and see what we do. And if that's your interest, we'd love to help to mentor you.
Yes, that's fantastic. And I think you learn nothing more than by shadowing or interning and seeing what it is, because you don't know if you're going to like it until you're in it. And
That's
so
right.
it's a great way. I love that you do that for our community. Thank you. And thank you for making our smiles better. And thank you for taking care of all of our kids' wisdom teeth and and my one or two that I think I had out. But we really appreciate you being such a wonderful community member and helping us out, because it is so important to take care of your teeth and go to the dentist. So if you want more information, go call them right now. Ask your dentist for a referral of Permian Basin Oral Surgery and Dental Implant Center. And if you are in that 60 to 70-year-old age and you are, wondering what the process is like for implants, go see them. They will walk you through it. So Dr. Erickson, thanks for sharing your story.
Thanks for having me.
And thank you for sharing the information with our listeners today. Appreciate it.
it.
We appreciate each and every one of you for listening today. And please pass this on. Keep this going. We want to share the good people of West Texas with the world. And we're getting more and more listeners every day thanks to you doing that. So big thank you. And we also appreciate those 5-star reviews. So thanks for doing that. I've seen a few of those lately. Also, don't forget our sponsors. They make this happen, so support them however you can. We have Omni Midland Hotel, which will be hopefully breaking grounds very soon. Also, the Laughlin Hotel, Rig ID Workwear, JoinCapClub.com, and Midland Cap Company. But as we said earlier, just support any local businesses however you can. And don't forget to support yourself. You can do that. How? By dreaming big, believing, and never giving up. Thanks for joining us. You make it a great day.